parent, when do you know that you need the assistance of a speech therapist? With me today is speech-language pathologist Carolyn Davidson. Welcome to the show.
Thank you.
So first of all, tell us what a speech-language pathologist is, because is that the same as a speech therapist?
Yeah, it is the same. The formal title is a speech-language pathologist, and what we do is we work with people from birth up until old age on communication. It's not just speech. I think that's a big misconception.
So it's communication.
Yeah.
So you say right up to old age.
Yes, that's correct.
So there is hope for me then.
There is hope, yeah. At the Speech Therapy Centres of Canada, we work with people from preschool. We work with lots of adults as well. And so whether it's an issue with saying their first words, pronouncing sounds, or as adults having voice problems or stuttering issues, or after a brain injury, we work with the full range of communication difficulties.
Now let's talk about kids for a bit.
Yeah.
Now, when should a parent seek the help of a speech-language pathologist? Is there a benchmark?
Yeah, there's a lot of different sort of red flags at different ages that we want to look at. And the big one is usually by 18 months, we want to see that kids are starting to use some words. So if you have a child who's 18 months old and they're still really only communicating by pointing or grunting at things, that may be time to look for some help. And then at 2, if your child isn't starting to put some words together like my cup or hi daddy, then we may want to look into getting some help as well. As they get older, we want to see that people can understand them. So usually by the time they enter school, their speech should be clear to mostly everybody.
Now, is there an issue, should parents be with autistic kids, for example, because I've heard cases where they're speaking normally and then they stop speaking.
Yeah, that does happen. The typical thing is for right from the get-go for there to be those delays, but there are some kids who are progressing normally, and at some point between about 18 and 24 months, they start to regress. So they start to lose words that they already had, and communication that they were using, they're no longer using. So that's a big red flag. If we ever see a regression in their skills, then we really want to seek help a little bit faster.
And why is it important for children, specifically with autism, to seek the help of a speech-language pathologist?
So any child who gets a diagnosis of autism has to have a language delay. That's one of the core areas that's behind. And that means that either their words are not coming in, or they may have their words but they don't know how to use them, so they're saying them inappropriately, or they're having a hard time making friends. They don't know how to start a conversation or take turns or ask a question to their peer. So they may have lots of language, but they're really not using it appropriately with other people, and their parents are concerned that they're not making friends in school.
And what's some of the techniques that you would apply to a child like that?
Yeah, and there's lots of really great techniques out there depending on the child's age and their level. For the really little kids, we use a lot of parent strategies because I'm sure you can imagine an 18-month-old isn't going to want to sit at a table and do really therapy with me. So what we do is we train the parents on how to engage their child at home, how to take everyday objects like a cup or flowers on the table and make them really exciting that they want to communicate about them. As kids get older, then we start to do more direct therapy with them, of course including the parents, but working on more specific things like putting sentences together and using those sentences with other people.
Well, that makes sense, because if the parents don't know how to interact or have the inability to interact with their children, and just sending them to you alone isn't going to help, right?
No, and the sessions are usually once a week. So once a week is really important, but if there's no carryover at home the rest of the days, then we're really not seeing the full benefit. So it's crucial that the parents are involved in the sessions.
And generally, how long, if I had a child with, a language issue, generally how long does it take do you fix it, or how does that work?
Yeah, and that's another one of those questions we get asked a lot.
Right.
So when we're doing our initial assessments, parents will say, okay, how many sessions does my child need?
Right.
And unfortunately, every child is different. So some kids may be able to, after 4 sessions, progress to the level that we need them to get to, and they're, discharged. Other kids, it's more of an ongoing problem that we need to be working on. We're making gains throughout the therapy sessions, but there's things to work on ongoing.
Now, do they need a doctor's referral for a speech-language therapist?
No.
No?
And depending on what the issues are, so, you know, if we're not talking about kids with autism,
right.
if somebody has a voice issue, they may need a doctor's referral. But specifically for kids, parents can initiate those referrals. So if you're concerned, you can pick up the phone and call somebody today and, you know, book an appointment.
And what do you mean is the most common thing that you're dealing with? As far as is it communication, interaction? What's the most common that you're doing?
So at Speech Therapy Centers, we see a lot of kids with autism.
Right.
That's a big area that we work in.
Yeah,
and another area is also working with kids having a hard time pronouncing their sounds. So they have words, they're trying to put them together, but they're not able to pronounce them really clearly, or also having a language delay. So the words aren't coming in, they're a late talker, they're not talking in sentences at the age that we would expect to see them doing that.
And so is it like a tutoring role that you become, or?
It's not, you know, tutoring I usually think of more in terms of the school work and that. We're more providing a therapy service to the families, whether it's directly doing therapy with the child or through the parents facilitating that at home.
And I'm just trying to think. If I come to you with my child, like, what is the process, right? Because I'm sure parents out there are thinking, I think my child has a problem, but I'm not really sure. And it's kind of, you know, like maybe they're afraid to seek help.
Yeah. So I think the first step is pick up the phone and call.
Okay.
You know, we have